A lot of use of the hands, particularly on the takeaway. I don't like to see a lot of bending of the wrists. I like to see the center of the chest. Maintain this triangle form between the arms and shoulders. So I like to see very, not a lot of hand action, not a lot of breaking of the wrists and all that stuff. The more you use your hands, the more problems can result. You're going to have to work on some of these hip flexor exercises, because what's happening here maybe is your right hip looks like it's shifting sideways a bit there. You see that, John? Mm-hmm. That's a power leak, which we couldn't see from down the line, but we can see from face on. But that's not a bad sway by any means. Your head, like I said, you keep your head pretty still.
Getting on the outside.
Well, it is, and that's where you're losing power, because you have nothing to coil up against. You want to be able to coil up against a braced right leg, and one of the exercises you should be doing is take a ball and squeeze it between your legs, because those inner thigh muscles, like if I said squeeze this ball and turn, try that feeling. You're not going to sway. You can't sway. You feel how that works? You see? So that's something that's a good exercise. And then some flexibility exercises for your hips. A lot of times it's either a weakness in the right hip or just a tight right hip that causes that lateral shift. So yeah, that's a power leak. Some bending of the left arm certainly is an additional issue that is keeping you from hitting it with power, because think about the physics of it. What are we trying to do? We're trying to maximize our swing arc, right? The swing arc. So, if we could keep our radius nice and wide there, maximizing that swing arc would be helpful. Now, some of that's flexibility. Some of it may be just a bad habit over the years you weren't aware of. But certainly the priority here is no lateral shift there in that right hip. And then coming through, you unload a little early. See how the wrists are, you don't really cock your wrists.
Yeah, I know that's something
and then, we're going to talk about that. I'm going to show you just as a video here of someone similar in build, and I'll just show you. You'll be able to see a difference as it relates to how he sets the club, takes it away wide, but then there's a full 90-degree angle formed between the left arm and the shaft that I don't really see you ever get. So some of that might be due to your grip. We need to take a look to make sure your hands, the golf club should be held across the fingers, not too much in the palm. I need to take a look at that. But see, you don't really have a wrist set there. You notice?
No, I think I used to.
Yeah.
I think I've gotten rid of it as I wasn't hitting the ball flush. So
right.
I took it out of there thinking I could.
Well, that's actually a way to hit it straighter, but you're going to lose distance.
Right.
So then you got a little bit of a chicken wing there in your left elbow. You can see how the left arm is bent there at impact. Mm-hmm. So yeah, here's what we're going to work on. I want you to get in front of the mirror and just in your house, just get what I call an L position. Where the left arm and shaft form a 90-degree angle, and see if you can maintain some width. In other words, push your hands out away from your body, maximize that arc width, you see. So, we want to maximize this distance here.
Gotcha. No, I know that I bent my arm, and see, look how he can get 20 G's.
But you see how stable his lower body is? There's not a lot of, he's winding up against a stable base. And I don't recommend for seniors to restrict anything. I'm not saying restrict your hips. Mm-hmm. I'm not saying that. I just need some stability in your right knee, and I need some stability in your right foot. So as you turn back, this knee doesn't collapse sideways. You see all that? Mm-hmm. That's where we're having problems. And then, of course, you're lifting that left knee, lifting the left heel, and bringing the left knee in a lot. I would prefer to look at his left knee. His left knee's moving toward the ball more. So he's sort of doing this. You're sort of doing this.
Gotcha.
Yeah. So
Oh, okay.
you see.
So tipping it towards the ball rather than coming in.
Right. And rather than bringing it
That way
in.
you're also not shifting your weight on
Exactly.
the outside of that right
Exactly.
foot.
You see how much float. You got a lot of float in that right knee. I mean, that's too much float for me. I don't like to see all that movement there. That just breeds some instability there. So, again, a good drill, just stick a ball between your legs, or, sit in a chair and just hold your knees and let your upper body turn against the resistance in your knees a little bit. I still want your hips to turn, but look, I can turn my hips, okay, but I don't need to do all that. You see what I'm saying?
Right.
I want your hips to rotate. Don't get me wrong there, right? I just don't want to see a lot of shift in the left knee sideways,
Right.
and I don't want to see the right knee moving a ton. So those are just the two things we're going to focus on. Getting a little bit more set, a little more width, and a little more stable base, and I think everything else will fall in place. You're physically very strong. I mean, you're strong. I can see that. You're wide shoulders. You're strong. You don't have a distance problem. You just have a little bit of a technique problem.
That's what I was hoping.
Yeah. Physically, I mean, you're strong. And so what is wrong with your impact position? Well, the reason you don't use your lower body is because you don't wind properly. So it's all cause and effect. When you don't wind properly, you can't use your lower body properly. It'd be like a pitcher trying to throw with his leg locked. Have you ever seen a pitcher wind up with his leg locked? It doesn't happen. So you got to get braced here. And one of the flexor exercises is just standing with what we call a straight line lunge and just rotate around that braced leg.
Right.
And you've seen that flexor
Right, I
exercise.
got to do more of that.
Yeah. So that's a good exercise for you. In all honesty, I'm going to give you this exercise. You're gonna flip out when I see you get on your back and you put your feet to you make a fist, put them between your knees, and your feet are windshield wipers. They move in and out, and I'll demonstrate what that looks like. But that's called the windshield wiper, hip windshield wiper exercise.
Actually, my trainer makes me do that.
Oh, really?
Yeah, he does.
Oh, good.
He knows I'm a golfer. He tries to do some stuff that's
For
golf
hips.
related.
Yeah, that's internal and external rotation of the hip.
Yeah, windshield wipers. He makes me do them, but I don't put my fist between my knees. He just has me doing it with my knees touching, but we can, spread them apart.
Yeah, well,
sometimes he puts a little ball between my legs.
That's fine. Yep. But anyway, so you can see where we're going with this.
Way out over on that side.
Yeah.
I'm getting all my weights getting.
So you can tell your trainer, I want you to work side planks and glute medius, which is this muscle right here. Tell him you're looking for stabilizer exercises, and these are good. You can take a band and put it around your ankles and walk.
Okay.
That'll help your glute medius, because you got a little bit of instability. I think your adductor muscle might be a little bit weak here.
So my whole right leg, I lost.
You got neuropathy. That's right. So
you lost a lot. I'm getting it back. They're telling me.
So there's atrophy there.
I have some definite. They said I lost a couple inches off that
right.
leg.
Some when you lose nerve function, you don't get blood supply to a nerve. It doesn't work anymore.
Yeah. I was having big trouble, and I think it's it's definitely coming back.
Yeah. I mean, you're plenty strong. It's just, like I said, I think I would talk to the trainer about some of those exercises. I think that would be helpful.
Cool.
All right.